So bariatric surgery, as you guys know, has been on the rise, and mostly because of its efficacy and safety profile. When we look at reproductive age women, bariatric surgery is known to improve related things such as anovulation and spontaneous fertility. And we know that after bariatric surgery, the risk of gestational diabetes and preeclampsia is reduced in the bariatric population. Another benefit we see with bariatric surgery is the risk of cesarean sections, wound complications are all decreased, as well as neonatal intensive care visits for the fetus. So what about bariatric surgery and male fertility? Well, again, not a lot of studies on this, not a lot of evidence-based medicine support this, but what we know is when we looked at fertility in men with obesity, what we see is bariatric surgery induces a significant increase in sperm volume, sperm concentration, and sperm motility. And what we do see is an increased mean number of fertilized oocytes in couples that underwent IVF when the males underwent sleeve gastrectomy, who are morbidly obese. And what this study shows is that bariatric surgery is confirmed to be safe and effective in artificial reproductive techniques in both in obese men. How about with women? Well, what we see is both for sleeve gastrectomies, and we'll talk a little bit about the surgeries in a moment here, sleeve gastrectomies as well as gastric bypass patients, we see significantly more PCOS patients becoming pregnant after bariatric surgery compared to the control group, 22% versus 3%. So again, this study shows that bariatric surgery is effective in weight loss in PCOS patients and may positively augment fertility rates. Again, very complicated, multifactorial. This is just kind of one dimension of it. There's so many more dimensions to it. But as a society, American Society of Metabolic and Bariatric Surgery, we had a consensus statement, and this was endorsed by the American College of Obstetricians. And what it says is that bariatric surgery is effective in achieving significant and sustained weight loss in women with morbid obesity and has been shown in case-controlled studies to improve fertility. However, the effects are not clearly understood at this time. Okay? So a lot more to learn about it, but it is very interesting. And anecdotally, I can tell you we see a significant improvement in fertility to the point where we have to counsel our patients, make them sign waivers that they can't get pregnant within 1 year after bariatric surgery.